Hi, everybody. Thank you so much for joining us today. I'm Michelle Morris with Consolidated Planning Group. We have Lynsy Meier with us today. She's going to be doing the main presentation, talking about how to maximize your Medicare and Medicaid benefits and how dual eligibility can help you and your loved one. I do have a couple of housekeeping items before we get started. First of all, I want to let everybody know that we do record all of our webinars. We present them live, but as we're presenting, we record them and then we put them on our YouTube channel. So if you miss anything, you can always go back to our YouTube channel and check out that recording. We also send an email after the presentation is done. So later on today, if you've registered for this webinar, pre-registered for it, you're going to get an email that has all the slides plus a link to that recording. The other thing that I want you to know is that we can't see you or hear you, audience members. We know you're out there. We can see how many people registered. And of course, we can see how many people are here with us live as we present. But since we can't see or hear you, you need to use the chat box to put in your questions and comments. And we do love the questions and comments. I asked today to know what kind of pets you have. So I see that Mark's got two cats. Sharon doesn't have any, but her neighborhood animals love her yard. And Beverly has two small dogs. I have one large dog. He is so sweet. He looks like he could snap a tree in half, but he's made out of sugar and he cries when we leave the house. That kind of dog. Anyway, we're here today to talk about our Medicare and Medicaid benefits and how they can help you. But before I turn everything over to Lynsy, I just want to let you know a little bit about Consolidated Planning Group, where we fit in, who we are, and how we can help your family. So we are financial advisors first and foremost. We are located just outside of Houston, Texas, but we can work all across the United States. So feel free to send any friends and family to us who we might be able to help if they have special needs loved ones or not. We do certainly focus on the special needs community. As a matter of fact, almost all of the families we serve have a loved one with some kind of disability, whether it be intellectual or developmental. Um, we've been doing this for over 30 years, and we do it because we live it. Every consolidated planning group financial advisor is also a parent to some individual with needs. We've been doing this for over 30 years. We are members of the Special Needs Planning Academy. We are chartered special needs planning consultants. We are National Social Security advisors. We truly live and breathe this life. So we understand. Ooh, I love seeing all about your pets in the chat box. Thank you for indulging me on that. Families come to us for comprehensive help, to plan your future. And we can partner with you on things like lifetime care planning for your loved one. Who's going to take care of them when you can't do it anymore? We look at transition planning and ABLE accounts and different ways, different vehicles that you can use to hold money for your loved ones. We can help you figure out how much money do they actually need for you to leave to them, how to get all of those state and federal benefits and local resources. And of course, we're here to educate you and to advocate for you. You know, um, we truly feel that we are experts in this field because of our experience and our education in special needs planning. And we're kind of rare in that expertise because, there are over 263,000 financial advisors across the United States. But out of those, fewer than 200 financial planning firms, not 200,000, just 200, fewer than 200 focus on this area. So it might seem like as you're out there Googling and looking for answers and you're asking Chat GTP for help, it might seem like there's a lot of noise because there are so few firms that really focus on this. And I'll tell you what, it was exciting for me, happened the last time I was on Chat GPT. I was putting together another one of these webinars and using GTP to help me word something just a little better for one of my slides. And it said, if you need help, you can watch this video to help educate you about ABLE accounts. And it was me. It was one of these webinars talking about ABLE accounts, and ChatGPT referred me to myself as an expert. How crazy is that? A little bit more advice before I turn things over to Lynsy. Think about what's going to happen after high school. Start thinking about that right now. There are further educational opportunities available to our children. There are residential communities. There are day and vocational programs and all kinds of exciting opportunities and programming out there, but they might have wait lists. You might have to plan early. You might want to go tour these programs and see what they're like for your loved one, which does take some time. So get started early and think long and hard about who is going to be the successor caregiver for your loved one when you can't do it anymore. Because many people say, oh, their sister will take care of them. It'll be fine. But that's not always the best answer. So I'm going to make sure that my contact information is in the chat box one more time before I turn things over to Lynsy. And she's going to get into how to maximize these benefits. But I'm here for you. Lynsy, I will be watching the chat box to see if there's any questions that come up for you, and I'll let you know. But feel free to take over. I'll advance the slides for you as we go.
Perfect. Thank you so much, Michelle, for having me today.
We're so glad you're here.
Thank you. My name is Lynsy Meier. I am a licensed Medicare advisor, and I specialize in helping the special needs community understand how Medicare and Medicaid work together and how to maximize those benefits when it's right for you to do so. Prior to doing this, I worked for a large Texas-based special needs firm, helping people with HCS services, ICF, Texas Home Living. So we kind of did a little bit of everything. And I learned a whole lot about the waiver programs in Texas. But what I didn't learn about was how Medicare really can boost benefits for those that have Medicare and Medicaid. And towards the end of my career path with them, I started working with Medicare a little bit more, learning a whole lot, and I transitioned into doing this full time. And I really love helping people understand these programs. So we do have an agenda for today, kind of a roadmap of what we're going to talk about. We'll talk about what it means to be dual eligible, how to qualify, a little bit about Medicare, Medicaid, and what is extra help where it comes to prescription drug coverage. We'll talk about continuing with traditional Medicare versus looking at Medicare Advantage as an option, extra benefits that come with how you choose the plan you want. And then we'll talk about, is Medicare Advantage the right option for you? So what is dual eligibility? It is just a fancy term for saying you have Medicare and Medicaid, and that's just it. So your loved one or yourself has a red, white, and blue Medicare card, which is, there's an example on the screen, and a Your Texas Benefits Medicaid card. So how do you qualify for Medicare? This is definitely a question that a lot of people have because traditionally to qualify for Medicare, you turn 65, you receive Social Security disability for 2 years, you have something called Lou Gehrig's disease, or you have end-stage renal disease or kidney disease, which you're on dialysis for. So those are the 4 traditional ways. But what a lot of people don't realize is if you have a special needs loved one, when you retire, when a parent collects their Social Security and retires. When a parent passes away, unfortunately, or when a parent becomes permanently disabled, their child will then become what's called a disabled adult child and receive those benefits. It is shortened to be called DAC status. And in order to get DAC status, you do have some qualifications. And the main one to keep in mind is that your loved one has to be diagnosed with their permanent disability before age 22. So on this particular discussion, I've actually watched CPG's webinar. It's amazing. It gives a lot of information about becoming DAC qualified and all of those Social Security requirements. So I absolutely give them a little shout out that that's a great presentation to watch.
So yeah, and I was just putting into the chat box about that acronym, DAC. For 40 years, that's all they called it, DAC. And then childhood disability benefits came along. Some people, I often refer to it as SSDI, but there's also RSDI, which is retirement survive. There's so many acronyms that basically mean the same thing, right? That are for children of people who have worked and earned that insurance, but maybe the child, for whatever reason, usually because of the disability, cannot hold their own careers and earn their own Social Security. So that's why DAC, childhood disability benefits, SSDI, RSDI, it all kind of can mean the same thing.
And it can be so confusing for families because if you call the number to ask for help from the experts at Medicare, Social Security, or Medicaid, they may use a different wording than you thought you needed to hear, and then you just think, well, I didn't qualify because it's not the same thing, when really it's all the same thing.
Mm-hmm.
That's a very good point. Okay, so then special needs individuals, once they turn 18 and have a permanent disability, qualify for Medicaid on their own standing. So I always like to talk about that just a little bit, because something that I have heard of over my years is, you have your child, you raise your child, and then when they turn 18, you're like, well, our family doesn't qualify for Medicaid because we have a higher earning status. And that's not the case. When someone turns 18 and they have a permanent disability, they qualify on their own record. So if they're not able to work or they make very limited working hours, you can apply them for Medicaid. So I think I saw that in one of the initial questions of how do I qualify for Medicaid? I recommend anybody, if you're not sure, to go to yourtexasbenefits.com. You can fill out an online application. You can call 211. Option 2 is your Medicaid benefits, and talk to them about it. And then there's local support offices. So if you ever have any questions, I would just recommend don't make an assumption that you don't qualify. Go through the steps and try. On the screen is a whole lot of wording. I'm absolutely not going to read that to you, but I do want you to know what it means. When you have Medicare and Medicaid, you receive a Medicaid level status. And on the Your Texas Benefits card in the top right-hand corner, you should see what your status is. And this is important to this particular presentation, because that status of Medicaid that you have tells you what pieces of Medicare you're going to pay for. So I'll go into that just a little bit more detail, but just kind of off the cuff, any of these levels, QI, SLMB, QMB, MQMB, or QMB plus is the same thing. There again with those acronyms. They all mean that your loved one won't have to pay that Medicare Part B premium. And this year it's $202.90 a month. So that's a pretty big chunk of change coming out of a Social Security check. So that's just one example of why it's good to know your Medicaid level. And then we'll dig a little bit further into what that will entail.
So we have already a couple of questions in the chat box. You mentioned on this previous slide that they must be unmarried. And yes, that's true. If your loved one gets married, then they won't be able to qualify for these benefits. And this is not the only place where we see kind of a penalty, if you will, to our loved ones who choose to get married. The other one that we see is that, an individual receiving SSI benefits receives $994 a month. However, if it's a married couple where both individuals receive SSI benefits, they don't get the full amount. It reduces their amount. So that's one question I saw in the chat box. And then the other question is, this applies to other states besides Texas, right? This is not just Texas wide. This is for everybody. Is that right,
So,
Lynsy?
yes. So I specialize in Texas. Medicare is a federal program. So, of course, the rules of Medicare cross all states. With Medicaid, Texas has a few, certain Medicaid rules and qualifications. And then, of course, they can set up their program possibly different than another state. So Medicaid programming isn't always exactly the same. Now, for these acronyms where Medicare and Medicaid come together, they should be the same. I can't say 100% that they are because I only really focus on Texas, but I would gather that these particular terms should be universal.
Fantastic. And then one more quick thing. Where does it say on this card where your level is?
Okay, so
Kind
see
of,
on the card, it says go back,
sorry.
Medicaid program name. It's going to be in
Mm-hmm.
the corner and it'll just say simply SLMB, QMB,
It'll have
MQMB, whatever it is. And that
one of
gives
these
you your
acronyms.
indication of one of those. Yes.
Okay. Okay. So then you can just flip back to this page and find out exactly what it means when you see what you have. Perfect. All right. Please continue, Lynsy. I'm sorry.
No, that's okay. Okay, so let's talk a little bit about extra help. So, extra help comes along with Medicare. So, when someone receives a Social Security income and Medicaid and they qualify for Medicare, what the Center for Medicare and Medicaid does is automatically assign a prescription drug plan to your Medicare. So then you have traditional Medicare, you have your Medicaid, and then you have a prescription drug plan. So there's something called extra help or low income subsidy, LIS, and that is particular to your prescription drug plan. So it's an important piece of Medicare to understand because it's going to cover your plan premium if there is one. It's going to cover any deductible. It's going to reduce the cost of your prescription drugs, which can be very, very expensive because so many people in our community take, multiple drugs or many per day. And sometimes they're not the generics that are inexpensive. Sometimes they're pretty steep in price. So I did pull out some numbers for you guys just to give you an idea of extra help. For 2026, now for individuals living in an ICF, an intermediate care facility, or an HCS waiver, if they qualify for extra help, which they would, 100% extra help, they're not supposed to see any prescription drug cost. Now, whenever you get full Medicaid benefits, the full extra help, but you don't live in one of those facilities, it kind of changed a little bit this year. Used to, it was free from a program that had been in place for several years that ended at the end of 2025. And it's not a whole lot, but you can expect to pay up to $1.60 for generic drugs and $4.90 for brand name drugs. And then for all other levels of extra help, possibly for those who have just SLMB, which is partial Medicaid, or QI, which is also a partial program, and you still qualify for the extra help that goes with it, that's still pretty reasonable pricing, $5.10 for generics and up to $12.65 for brand name drugs. So if you have somebody needing a high cost insulin, you're looking at $12.65 instead of the steep pricing.
Fantastic. Now, talked about that card and figuring out what level. What if it's blank there? How can people figure out what level they're on?
So if that card doesn't have it, when you qualify for Medicare, really you have a level assigned to you, so they should be sending you out another card. You can create a Your Texas Benefits account and see if possibly the card generating there shows it. If not, call 211 and press your option 2. And then once you finally get somebody on the phone, if your loved one is disabled, ask for the MEPD department. And that actually gets you a specialized supervisor, specialized level of Medicare Medicaid advisor on the phone, and they tend to be able to help a lot more than just the traditional person who answers. So just go ahead. I can't even tell you what it stands for. I apologize. I should know that, but M like Mary, E like Edward, P like program, D like director.
Okay, fantastic. And before we go on, one more clarification. So when the parent turns on their own Social Security retirement benefit, or if the parent passes away, or if the parent becomes disabled and turns on disability benefits, 24 months from that date is when the child will get their Medicare. Am I correct on that?
That is correct. And
Perfect.
another thing to know is every once in a while, you may be surprised that 24 months doesn't go by, but the Medicare card comes. And that's because they go back to that day that it was, you become eligible, not necessarily the day that you fill out that application. So sometimes the time frame is a little bit quicker, but you would expect to not wait more than 24 months.
Perfect. Thank you so much, Lynsy.
Sure. Okay, so why consider Medicare Advantage? So, like I had said a little bit earlier in the presentation, traditional Medicare means you have your red, white, and blue Medicare card, you have your Medicaid card, and you have your prescription drug card. The benchmark plan for 2026, meaning there's no premium and it's covering meds for those that are being automatically signed up, is called the WellCare Classic. And that has you covered traditionally. And that's all you get. You get your Medicare doctors, get your Medicaid benefits, and you get your prescription drugs for the most part at no cost if you have the full benefits. But there's nothing extra to it. And that's wonderful to have those health benefits. You can see your doctors, get all of your prescriptions. But if you're looking for a little bit more or your home needs a little bit extra help in the way of benefits, look at the right side of the screen, and moving to Medicare Part C or Medicare Advantage is going to also get you the medical benefits that you're expecting, the prescription drug coverage, but it's going to add in dental care. It's going to add in money for eyeglasses, hearing aids. There's a healthy food and over the counter benefit. There's transportation assistance. There's fitness benefits that can good night. I'm sorry. There are fitness benefits and gym memberships you can sign up for in your local town. And there's meals following hospitalization. So that's not even all of them. That's just kind of touching on the highlights. So it can add a lot of extra things to your health plan.
Fantastic.
So not beware, but be aware. So I always believe in presenting pros and cons because I just truly believe, even though I am a Medicare representative, so I sell plans, I am not a salesperson. I truly believe in presenting options, making sure people understand what they have available to them, and then make the best choice for their family. So one of the things that I always think is important is if you sign up for Medicare Advantage, you are choosing to be in Medicare that is managed care. So basically, the federal government that runs Medicare pays health insurance companies a stipend to take over that care and manage it for you. And that's why they can add in the extra benefits, because the government is giving them some money to take that over, pay the claims, make sure things are done. But there are some things that are required whenever you do that. So you're looking at having to be in network with a primary care doctor. You have to be in network with specialists, imaging centers, hospital systems. So you're looking at a network instead of just free choice. The pharmacies are typically in network. You don't have to worry a whole lot about that. All of the major ones are. It's kind of the mom and pop ones that are one-offs that I'm not always sure if they're going to be in network. And one of the things that I always think is important to make sure people understand is with these plans, usually you do have to have referrals to see most specialists and prior authorizations for certain services and prescription drugs. And then, of course, you have to live in the service area of the plan. So those are all things that we look at. But one thing I like to say, even though that sounds like, oh gosh, I don't know if I want to deal with a network of doctors and all of these things. If you have the Star Plus Managed Care Medicaid, which we'll talk about here in just a little bit, those are all the same requirements that Star Plus. So basically, how I describe it is, if you already have those restrictions with your Medicaid, probably even though you have to be in a network with your Medicare, the network widens because a lot more doctors accept Medicare dual plans than just traditional or Medicaid alone.
So,
I know I
man,
used a
it's a
lot of
lot.
words there. I got
It's a
twisted
lot.
up a little bit in my explanation. So tell me
No, no,
how
no,
to
you're
clarify.
fine. I love to, yes, I get twisted up sometimes too. So if you go with Medicare Advantage, basically you have to be aware that you're in network and you have to keep an eye on that with everything you do, in a nutshell, correct?
Yes, ma'am.
Okay. Um, so a question that I'm seeing in the chat box, once the parent turns on their benefits and the child gets their benefits. Now, if the child is getting Medicare or from their own work record, the parents switching doesn't really have much to do with theirs anymore, right?
Right. So how to get Medicare on your own if you're able to work is you work your 20 quarters. So, whenever I am able to retire, I work my 20 quarters, I pay in through my paycheck, and that's how I get my Medicare. So if your child is a working and paying into the system, they'll qualify for Medicare on their own, and then yours wouldn't be looked at for them. That's correct.
Okay. And then can the parent and the child have different levels?
Well, many times the child is qualified. So the level is based on Medicaid eligibility. So many times the Medicaid eligibility that the child qualifies for, the parent actually doesn't. But there is
Mm.
always a chance that, if the child is qualifying on their own and they have Medicaid, they may have a higher level, but the parent still is in a qualifying bracket that may be less because they make more. So they could have, maybe a SLMB and the child could have full benefits, which is MQMB. So yeah, that could happen. Remember, the level is based on the state required how much money you make.
Yes, yes. They always want to know how much money we make. And I just want to remind everybody
How
that,
many assets
you
you
know,
have, how much money you make.
yes, absolutely. I just want to remind everybody that, Lynsy and I both are service people. We're here to help. So even after this webinar is finished, if we don't get to all of your questions, we're going to give you the opportunity to reach out to either one of us. She is more on the Medicare Advantage, the Medicare information. I am more on, other benefits and financial side, but both of us are here to help you and to serve our clients. So if we miss your question, don't panic. just reach out to us after this, and we'll tell you how to do that. There was one other thing. Oh, I did want to ask, does this stuff cover you if you go on vacation or you leave the country? You can still use your Medicare, Medicaid stuff or not?
So, anywhere in the United States, it is set up that if you go to an emergency room, you are considered in network. So, the emergency rooms are set up to accept all insurance and not turn anyone away. Now, as far as out of the country, Medicare plans typically have some minimal coverage, but it's not going to be where you show your card and receive services. A lot of times it is, you save your bills and turn them in and you get reimbursed for a percentage. So outside of the country, I would say it's very, very limited. But here in the country, if you have an emergency, then you should be able to use your insurance wherever you are.
Perfect. I think we're caught up. There we go.
Okay, so where there are things to be aware of with Medicare Advantage, there's also things to be really careful about when you have just plain traditional Medicare. If you have traditional Medicare alone, it can be incredibly expensive, and we really never recommend that you have only that. Now, traditional Medicare typically covers 80% of your healthcare needs. So you have to have something to cover that other 20%. Now, if you have your Medicaid, of course, that steps in as your secondary. But with the way things have gone over the last few years with the Medicaid unwinding and, having a hard time getting back on track with that whenever you fill out your application, it's been a really rough go. And sometimes you'll qualify for your Medicare and you haven't quite figured out the Medicaid side, or you no longer qualify for Medicaid because you are able to work, but you are keeping your Medicare. So there's lots of different reasons why you may have one without the other. So I want to make sure that you know that if your Medicaid is not active and you go into the hospital, I have a little scenario here on what that 20% could look like on traditional Medicare alone. So if you go into the hospital as an inpatient for 2026, the hospital deductible is $1,736. So say you rack up a bill for $20,000. That sounds like you were there a really long time, but honestly, at this point with testing and the healthcare costs, that's probably a 1 day, 2 day stay. Very expensive. So your portion of that is, your 1,736 plus 20%, that's almost $6,000. But gosh, think about if it is a longer stay and you have to have a major surgery and you're looking at a bill of $100,000 or more. Now you're looking at over $20,000 of paying out of pocket. So one thing that I really like about Medicare Advantage is if you lose your Medicaid and you're on the Medicare Advantage plan, there is a built-in kind of free look where you have 6 months to get your Medicaid back and reinstated before they drop you from the plan. So it kind of keeps you covered where you have a maximum out of pocket to pay. With traditional Medicare, there's no maximum out of pocket. So, gosh, the bill could just go up and up and up. There is just no ceiling. So I think that's really important with Medicare Advantage is if the Medicaid gets lost, you'll pay a copay at the specialist, a co-insurance at the hospital. And once you get to the maximum out of pocket for the plan, you are not going to pay anything else. So that is one of the things that I like about Medicare Advantage is in case something happens with the Medicaid, you're still protected.
Yeah. And so doesn't traditional Medicare Part A cover the hospitalization? You said it just covers
No,
80%, huh?
so there is for Part A, there is a hospital per stay deductible. So it covers the hospital stay after the deductible. Now, and then you pay your 20% of all of your services that are done.
Fantastic. Yeah. And people are pointing out, when you switch over from SSI to SSDI or any of those 14 acronyms that all mean SSDI, very often, it's supposed to be easy. You're supposed to just switch that. After you're on there for 2 years, you get your Medicare, you keep your Medicaid. Sometimes you get dropped off and you have to file a new H-1200 form. That's the secret for everyone. If you get dropped off of Medicaid when this whole transition takes place, you just need to file a new H-1200 form. You can even write an email or a cover letter with that says, remember that what was it? MEPD acronym?
MEPD, yeah.
Yeah, so you write on there MEPD, required coverage group, because that's what, and they're pretty good at reinstating that real quickly.
Yes. I saw somebody pop up in the comments a second ago that said, is it normal to be really confused? It really is,
Yes.
because even when I'm trying to explain it, there's so many things I want to say, but then my mind kind of switches and I go, well, let me try to say less, because this is supposed to be a basic overview, but sometimes I just dig a little bit too deep and then I have to back myself out of what I'm saying to try to stay just pointing out facts. So if you're not sure, just call me. And a one-on-one conversation slows things down. We talk specifically about your scenario, and it becomes much more clear for sure.
Exactly. And the same with me. If there's a webinar you've seen or something you want to know about financial side of this, that's why we offer consultations. That's why we give out our contact information. Just reach out, we'll help you out. So tell me a little bit more about these extra benefits and, you know, dental, vision, hearing, all of these things.
Yes. So let's just talk about how it can be so helpful. Now, I can't talk about any specific plan on this webinar. I have to keep things broad, but I do work with 16 Medicare companies. So I am trained on multiple companies. I can look at plans across Texas, so I can see what different companies are offering to our members in a dual category. So I just I kind of broke it down and did an average, so you know what could be available in your area, but it's not necessarily exactly what will be available. That is county specific. So I would love to talk to anybody who wants to know what's available for them. Usually you've got a couple of options that it comes down to that would be really well and has a good network of doctors. But for dental, you could expect around $3,000 for preventative and comprehensive coverage. We'll get into dental just a little more because that's such a hot topic for our group. For vision, of course, your exam is going to be included, but also around $300 for frames a year. There's on average about $2,000 to go towards hearing aids a year. Hearing aids are incredibly expensive, so that's a nice chunk that goes towards that. And one of the things that helps people out a whole lot, especially our population who can live on their own with support, but they're not able to do a lot of working, is the healthy foods and over-the-counter benefit. Usually that's around $150. Some goes up by about $30 more, maybe $30 less, depending upon where you live. But that's a good chunk of money to get your healthy groceries and some over-the-counter items that you need every single month to supplement your home. And when I say healthy foods, not always is it only meat, cheese, fruits, and vegetables. I mean, sometimes they throw in your condiments like your ketchups and your coffee and lots of different canned goods and quick and easy meal prep things. So it's a really
And
nice
some people in the chat box are saying that you can even use that over the counter items benefit to maybe think about, let me see this, so I'm not saying it wrong. Utilities, is that right?
on some. Yes.
Electric and gas.
On some plans, you can use it towards an electric bill. And even some plans, it's available towards like gasoline in your car. That's a little bit minimal and pretty specific. Every once in a while, I'll see a plan that you can use it for dog food. So they really are trying to help people out to live their best life in the community.
Well, that's
So
fantastic.
another benefit is transportation assistance. That's like if you just need help getting to and from the doctor or the pharmacy, you can call ahead and there's a number of trips that you can use. The gym membership I had mentioned, or sometimes just an online fitness benefit is included, or a discounted Fitbit tracker or something like that to help you count your steps. And then a lot of the plans offer a certain number of meals after a hospitalization, just so that you have a nutritious meal in the freezer, while you're still getting better and you just don't, you're not up for cooking. So there's lots of cool things included in the plans. So like I said, I want to highlight dental just a little bit. And we'll just talk about like what can, two, three, four, I mean, even some plans have $5,000 worth of dental. What can that do for you? Now, I worked for a special needs provider a very long time. And one of the things that, came up regularly with our annual discussions and daily discussions is oral hygiene and how much oral hygiene really affects the rest of your health. It can affect your heart health. It can affect so many things. It can even affect your confidence. So having that extra dental money can really improve a lot of ways. Dentures are included on the plans a lot of times. The bridge, just to fill in, maybe a gap, help keep people from having pain in their mouth that can cause, negative behavior things, all kinds of health related benefits come from getting the dental treatment that you need each year. And one of the things that I want to highlight, and I'm not necessarily, I'm not plugging them, but I wanted to give them a little shout out, is Enable Dental. The reason that I
Mm-hmm.
want to mention them is because they accept some insurance, which is really great, but they're a traveling dental provider that comes to day centers, they come to group homes, they go to assisted living facilities, and they're even willing to come to your home if your loved one is really anxious or isn't able to get out and about to get their dental. And I think that's a really positive program. So I did put their
Mm-hmm.
information on there because I don't think everybody always knows that's an option for your loved ones that just can't get out and get the dental care that they need. So Lynn Clauser is their community relations person, and she would love to talk to you to see if you're a candidate for their care, if that's something that you may need.
And if you're interested in that, we have had a webinar with Lynn in the past. So if you go to our YouTube channel and search, I don't know if you can search her name or by Enable Dental, or just put in dental and see what comes up in our list of videos. But we have had specific webinars with her before, so you can learn more about her that way as well.
So, a question that I get quite a bit is, oh gosh, there's these extra benefits included in Medicare Advantage. So, if I don't stay with the traditional of what the state automatically sends me, am I going to lose my waiver? Am I going to lose my extra services? Am I going to lose my food stamps? Is this going to count against my income I have to report? All of those kind of things come up. And the
I
answer,
must have been psychic because I saw those questions that you were just asking about have come up in the chat box, and I've kind of let them go because I knew you were going to get here.
yeah. So, and that, I mean, being nervous about making a change is completely normal. The very
Hmm.
cool thing I can share with you is you qualify for Medicare on your own, you qualify for Medicaid on your own, and your choice of your Medicare plan does not have absolutely anything to do with any of your other benefits. So if you have an HCS waiver, or your loved one lives in a group home, or you're getting any other services through the state, qualifying for Medicare and making a Medicare decision for what plan you want doesn't take away from anything else. It is these benefits that I'm talking about of the extras, those are just considered perks of the plan. So they're use them or lose them sort of perks that you have, but it doesn't say, oh, well, now that you have this, you're not allowed to have that. So don't worry about that. I work with a lot of people living in all different types of environments, and having this has never hurt any of their other benefits.
That's such great news.
Yes. So something that has gotten, I mean, it's been going on for several years, but Medicaid is really trying to take a step forward with the managed care Medicaid. So if your loved one has the Your Texas Benefits card and no managed care card, meaning no insurance company is kind of taking over those benefits and managing the claims, if you have just the Your Texas Benefits card, that is considered like TMHP Medicaid or traditional Medicaid. When you have the managed care, it would say like Star Plus. So United Healthcare Star Plus, Molina Star Plus, WellPoint Star Plus, those are all managed care Medicaid plans. Those are the ones that have the networks included. Sometimes the networks are pretty limited. And sometimes people get pretty frustrated with only having that managed care Medicaid, because even though you have your Medicare where you can kind of go wherever you want, you're still restricted to where you can go because you're still needing to get that other 20% paid by your managed care Medicaid company. So Star Plus is a cool program. If you do not have HCS, or you don't even know what that means, it means you have the ability to get some extra services to help you in the community. Star Plus is adding those services through Medicaid for those that don't qualify for like a home and community-based waiver. So there are some really great benefits to the Star Plus that sometimes people don't know are out there. They're just looking at it and going, well, gosh, that's just limiting my doctors, or I can't see the specialist I want to anymore. But what they're trying to do with Star Plus is add benefits and keep people out of the nursing home and give you that opportunity to have in-home care and support. So if I wanted to bring that up, even if you don't have Medicare, but you just have Medicaid through a Star Plus and you don't have what's called an HCS waiver or something like that, talk to Medicaid and see what other benefits they could be providing to you, because there are some things they added in that can be incredibly helpful to families. Now, how I tie Medicaid on the managed care side to the Medicare is one thing they're working on really strongly starting last year is something called fully integrated dual eligible. So what the state's hope is to use this FIDE program and get people to use the same company for their Medicare and their Medicaid, so that there is a centralized claims, person that's managing your care. So basically your Medicare is through United Healthcare, your Medicaid is through United Healthcare. You're considered fully integrated dual eligible now. So fully integrated means United Healthcare is looking at all of your healthcare claims. And what the goal of that is to be able to process things better, see things. You'll have less denials. Things get processed much quicker because they can see the full picture versus just the little picture of their side of things. So I think the kinks are still being worked out, but that is something that they're trying really hard for. And I think it could take a really nice positive step. So is Medicare Advantage right for you? Now, one thing I just want to say is I will be very, very cautious if you come to me and ask me for help. I am a very careful person. I don't ever want anybody to sign up for a plan and then hate it. So what we're going to do is we're going to look at your eligibility. We're going to check your network. I don't just look on a list and say, oh yeah, your doctor's on the list, because we all know if you've ever looked at a list, the list is not updated. So no. I take the time to call every one of your doctors to ask them, do they take the plan? Now, there is a chance that if they take it now, they may not take it in the future, but for the most part, we don't run into that. Doctors like to stay consistent for the most part with what they accept, and likely they'll continue to accept it. I just can't make that promise. We look up all of your medications to make sure they're on the formulary of the plan so you don't have surprises. We compare your plan options, and then if you're comfortable, we'll make an enrollment.
But I just, Lynsy, there are certain things that your group does that are the same as what we do at Consolidated Planning Group. But we truly feel that, Lynsy is such an expert when it comes to the Medicare plans. That's why we want you to be here to be able to help our clients as well, because you're so good at what you do. And when it comes to things that overlap, they'll come back to us for those things. But for you, I mean, we don't do this at all. So if you need help with these Medicare, Medicaid questions, Lynsy is a great resource. We can help you, but we can't sign you up for Medicare plans.
Well, thank you, Michelle. That's so kind. And same goes for you guys. Y'all are an amazing resource to everybody.
Thank you. It's a love fest.
Yes, for sure. So just so you guys know, I'm also not one of those people that you sign up with me and then you just, forget who I am and that kind of thing. I tell every client that I serve, it's now my job to provide continued support. We are in this together. If you have questions, if you get a bill, if you're just not sure, if you need to find a doctor, and your primary care isn't pointing you in a direction, I can help with all of those kind of things, and I do it on a daily basis. So I pride myself in being someone who is a continued resource for you once you're on a plan with me. Like I said, we're in this together now.
Absolutely. Good luck trying to get rid of us.
Right. So we're just kind of wrapping it up. We're pretty well running out of time. It looks like we'll have a couple minutes for a few more questions, but I do want to provide my contact information. My phone number is there. My email is there. If you like to text, I text. However you would like to get a hold of me, that's wonderful. I want to share a couple things. So if you're new to Medicare, you can enroll in the month you 3 months ahead of your enrollment month, the month you enroll, in 3 months after. So that's kind of your new enrollment window for Medicare. There's also annual enrollment that comes up every year from October 15th to December the 7th, and that then enrolls you in a new plan starting in January of the following year. However, I caution you, or I am excited to tell you that you don't always have to wait for this time frame. So if you've missed your initial enrollment window and annual enrollment is still several months away, call and let's talk about it. There are special enrollment opportunities all the time. I can't guarantee that it will fit for you, for what your plan is, but if we're able to look at a special enrollment opportunity, then we can enroll for the first of the following month of our conversation. So there is some wiggle room with those enrollment windows. So I'll turn it back over to Michelle and answer any questions alongside her. But thank you guys so much for your time today. It's been a pleasure.
Yes, I do have just a couple slides. You guys, if you've seen some of our webinars before, you know that we are here to help you with basically anything special needs related. Lynsy, I did hear some very interesting news, and one area where a lot of our families kind of get caught up is that um, enrolling in SSI and Medicaid before you enroll in your retirement benefits and SSDI and Medicare situation, because it has been that sometimes you can kind of lock your child out of Medicaid if you apply for SSDI and Medicare too early. But it sounds like that might be changing. Have you heard anything about that?
So I am not 100% up to date on that. I love the idea of it changing. Another thing I would love to see happen is when you have a permanent disability and you're on SSDI, you don't have to fill out a renewal application every year. So I do want you guys to know, when you do switch over to SSDI, you are required to fill out a Medicaid application. They're not going to just pull it over from your SSI. I just went through that with a family member here recently when my father-in-law retired. We have a special needs, or I have a special needs brother-in-law, and my mother-in-law was just so surprised, like, we've gotten Medicaid all these years. Why do we have to apply now? Don't they know? And sadly, yes, they know, but they're still going to require you to fill out the paperwork. So the things I like to really say about Medicaid is, please keep an eye on that mail that comes. Fill out whatever they ask you for, even if you think you shouldn't have to, and don't just mail it back and forget it. fax it back or upload it on the yourtexasbenefits.com. Keep some sort of record of when you submitted it, because they are really quick to drop you. And sometimes it can be, very frustrating to get it back.
Yeah, absolutely. So at Consolidated Planning Group, we still offer a free consultation. These are on Zoom. They're usually 30 to 45 minutes, depending on what questions you have. It is our goal to answer your questions first. We learn a little bit about your family, and then we go into some advice that we can give you, kind of quick and dirty from what we see on your intake form. And then we talk about, the process of working with us to see if we would be a good fit. I would encourage all of you to schedule your free consultation. You would be meeting with either myself, my husband, or Allison Scaberg, the owner of our company. We offer, our YouTube channel, our Instagram page, we have a podcast, we have our Facebook, all of those ways that you can keep in touch with us. But we will be reaching out to see if you have additional questions after today's webinar and if you want to schedule this consultation. So the quickest way to make us not call you is just go ahead and schedule your consultation yourself. So you can call or email the office. You can use the QR code, or I've put my personal contact info in the chat box again, so you can reach out to me personally and I can schedule your free consult. This is our entire team at Consolidated Planning Group. There's our what's the word I'm looking for? Our awards, not awards, but our things that we've done,
Credentials.
chartered. Thank you, credentials. Our credentials are listed there, plus the fact that we've been doing this for 30 years, even though we sometimes lose our words. We've got a great staff who will be reaching out and help take care of us and get those appointments set up. And then there's a simple little disclosures page as well. I don't see any more questions in the chat box for right now that I think we haven't gone over. But again, if anybody needs us, we aren't going anywhere. We are here to help. We would love to hear from you after today's meeting. Thank you all, especially those in the chat box who have helped me by throwing links in there, answering questions, and all of that. We really appreciate you. And I love the collaborative teamwork that we have found in this community. Thank you all for that. Thanks for being here, Lynsy, and for sharing all of your information. And we'll talk soon.
Thank you so much, Michelle. And thank you all for listening in.
Absolutely. Have a great day, everybody. Bye bye.
Bye-bye.